Hello, and welcome to the Health Data Ethics Podcast. I'm your host, Jenny Owens, and today we're going to kick off a series where we're going to walk through the Joint Commission and Coalition for Health AI guidelines for responsible use of AI in healthcare that were released late last year. We're going to walk through these kind of slowly and really take our time and stretch and think about each one of these. And I wanted to start first and foremost with the item that appears on so many lists of responsible AI approaches, and that is writing an AI policy. That is number one on almost every published list of ways to practice responsible AI. And it should not come as a surprise that the Joint Commission and the Coalition for Health AI, or CHAI for short, leads with that policy as the foundation for everything else. Now, I suspect because CHAI mentioned that they were going to be coming out with some playbooks to follow up on their guidelines, so I would expect that we will see a lot more publication on this from CHAI in the coming months. But today, if you wish to practice responsible health AI, that AI policy is your first deliverable for any AI governance program. And the thing that I found when we were working on our own AI policy is that because it is the first deliverable and it's the first concrete step in any sort of AI governance plan, it becomes a bucket that carries a lot of hopes and dreams. A lot of people want a say in AI governance. A lot of people want their perspective reflected. And because that policy is the first thing that anyone can really point to and say, we did this thing, it ends up carrying all of that baggage for what AI governance can be. And that's really human. It's really human to say, hey, we all think that this is a problem. Culturally, we all agree that this is something that does need to be addressed. But what it can do is it can make your policy kind of bloated. It can make it diffuse and very difficult to interpret for an end user. And it can get a policy stuck in your approval process because why is this policy being written by, a group that should not necessarily have governance over artificial intelligence, but they saw the gap and they're looking to fill it. So here's where we really reframed our approach, sort of stripped back all of the thoughts and the feelings and the opinions about the policy and pared it back to the bare minimum. A policy is going to give you a standard by which you can measure your governance program and a benchmark against which you can hold people accountable. That's what the policy needs to do at a bare minimum. Once we focused on just that, we found that our process got a lot more clear and straightforward. So the goal for our AI policy is to create an environment in which a health system can safely experiment with artificial intelligence. And both of those words need equal weighting, safely and experiment. We also wanted the policy to define the governance framework within which that safe experimentation can happen. And I just want to be really clear, when I did this during my day job at Cleveland Clinic, we started that drafting in November 2024. We were not starting from scratch. We had a previous draft that had been written by our previous AI governance person. So we were already starting probably 2 or 3 steps ahead. But I want to be really careful about the timeline because in November 2024, Joint Commission and CHAI's responsible use of AI in healthcare had not been released. We were drafting kind of blind. What we did work with and what we did reference was the National Institute of Standards and Technology's AI risk management framework for the risk management approach. And we also did a lot of reading of the EU AI Act for that risk tiering logic. So we were looking at federal level and international guidance that were both principles-based. What we didn't have, and what we so rarely do have in the healthcare space, is healthcare-specific operational guidance. So we didn't really have a lot of citations to point to when somebody asked, why are we doing this in a particular way? Sword cuts both ways, right? So this was a really difficult part of being sort of on the early edge of drafting AI policy because we were building these principles from scratch without sort of the cover of a regulatory guidance. But the advantage, actually, is that when you're building something from first principles, you get a chance to really say, okay, what matters to us in the organization? Where is it important to agree with other subject matter experts in our organization? And those principles age better than citing a guidance or a regulation that might not hold true. So when the Joint Commission and CHAI eventually published their guidance, our policy turned out to broadly align with their frameworks. And that really felt like kind of a personal vindication that we were on the right track. We were thinking along the same lines. We're aligned with where the thinking in healthcare AI governance really is going. So just a note, because I've talked a lot about the Joint Commission and CHAI guidance. Right now, this is guidance. This is not a requirement. I have not heard any evidence that Joint Commission is citing organizations for not following this guidance yet. However, I do expect to see the Joint Commission move in this direction in the future. So they would be enforcing these guidelines. They would be making sure that hospitals are adhering to these guidelines. So if the Joint Commission says you need a governance process, today it's a suggestion. Tomorrow it might not be. And so we want to make sure that we're doing the work and that we are making sure that we are setting ourselves up for success in the future when the Joint Commission comes to do surveys. So I mentioned that there was a previous draft inherited from a governance leader who was doing that really hard sort of first principles work of putting AI governance on the map in a large health system. I cannot say enough good things about our previous leadership in AI governance. They were brilliant. They were approaching this from a legal perspective, so bringing a lot of subject matter expertise that is not always represented in AI governance. And the policy as written was really substantive. We carried forward several things from that draft. The AI model lifecycle framework, so from idea to development to validation, piloting and post-deployment monitoring. We grabbed a bunch of definitions from that document as well. And what really survived is the core AI task force mission. That all came from the original work. It's all still in the policy today. And I want to be really clear. The challenge is definitely when you're writing a policy like this, it's not that there was anything necessarily wrong with it. It's that the draft reflected that sort of structural tension of I want to do a lot of things inside one document. So we wanted to both justify the existence of AI governance and define the AI governance. I mean, if we're writing a policy about it, we don't need to justify the existence. The policy does, by definition, justify the existence. The policy applied to AI, but the boundaries were a little, and so we had some model development framework in there. We had some data science process, and in the time since, we've really firmed up some of the data science process. We have new roles in data governance, and so I wanted to make sure that our AI policy was really staying in its own lane and not staking out territory that might have been up for grabs previously, but is firmly in somebody else's space today. And then the policy was trying to do a lot of things from, a high-level philosophy. So why is it important that our AI should not be biased, all the way down to, low-level operational guidance. And so we removed the operational guidance and left that for a standard operating procedure or a lower-level document that wouldn't necessarily have to go through all of the policy approval hoops every time we wanted to change and update it. And this is absolutely reflecting, the same problem that I called out in the intro, right? We have one document, we have a deliverable, we have so many smart people who want to do the right thing, who want to give their input. But what you end up with is a policy document that is trying to do a lot of things, and sometimes they're in tension with each other. And this isn't a critique of anyone or anyone's product. This is just kind of a lesson about what happens when you try to do a first-generation policy in an area that's red hot and everybody's got an opinion on it. So the biggest decision that we made when we were trying to be disciplined about how do we get this policy across the finish line and approved, we cut everything that was not explicitly about AI governance. And we wanted to make sure that the document was really anchored in one accountability standard. So this is our group for AI governance, and they are the ones who are responsible for AI governance across the enterprise. Everything else kind of falls out of that. So our vision statement didn't really make it because we don't necessarily need a vision statement and a policy about what AI can be for the enterprise. I don't disagree with the content of the vision statement, but the policy we found was not the place for it. We had discussion about data provisions. Those should be the purview of data governance. We had operational standard operating procedures that belongs in, our SOPs and not necessarily in the policy. We can write the SOPs and allow them to rely on the policy. So the Joint Commission and CHI frameworks are doing the justification for us. So the justification doesn't necessarily need to be in the policy. So I think it was a worthwhile intellectual activity to have done all of this, because formalizing that vision, saying the justification, and doing some hardening of that as you're bouncing these ideas off of other groups is super valuable, but it doesn't necessarily need to be in the final draft. When I was approaching our new AI policy, I was really looking very heavily towards the Institutional Review Board and their model for clinical research. So I was looking for a policy and a framework that would say the risks of doing this thing must be matched or outweighed by the benefits of doing this thing. And this group is the one that decides that. That's the underlying structure that I was looking for, and the IRB is exactly the kind of thing that I was looking at. The IRB structure also gives you pretty clear tiering that is based on the risk level of the project you are trying to do: exempt, expedited, full review, and also a good model for continuing review. In the AI space, you might call this post-deployment monitoring. And also like really clear boundaries, right? The IRB doesn't review hypothesis formation. So if I say, hey, I would like to do some work on vascularization factors in tumor recurrence, the IRB is not going to tell me whether that's a good idea or a bad idea. They're just going to say, does your protocol meet our ethical and our regulatory standards? They also don't align human resources or financial resources. They're not going to help you with funding. They are not going to help you with people. They're just going to, again, look at your protocol and tell you whether this does or does not adhere to our criteria. So that was the model that we were looking for. And I really worked in the new policy along with the team that worked with me to draft the policy. They were phenomenal. I truly enjoy working with this group at Cleveland Clinic because we get multiple perspectives: clinical, legal, compliance, and what comes out the end is so much stronger than what any one of us would do on our own. So as we were looking to sort of recapitulate this IRB structure in our AI governance, we were looking at areas where we would want AI governance review pre-pilot and pre-production, but not necessarily during development. So we used to have a much more hands-on approach where you could seek governance input early on in your process, and you could even bring things in very early in your development process for awareness or for input. And we decided, due to the volume, that we were actually going to do away with those required checkpoints. Those early development points, they don't create risk. That risk appears when you're starting to do integrations, when you're starting to pilot, when you're starting to deploy, and we wanted our governance calibrated to the risk of today. CHI and the Joint Commission both have a real emphasis on post-deployment monitoring. And this is an area where we really sort of beefed this up in our policy, saying that post-deployment monitoring is going to be tiered to the risk of the product itself, and it will be governed also by our AI governance group. The other thing that we added to the policy was a really firm stance on what AI is. So we obviously had definitions. The definitions came over from the original policy. When in November 2024, we were looking at documents that were really wrestling with how do we handle the boom in generative AI? And we had one plan for how we were going to govern traditional artificial intelligence, machine learning, these kinds of things, and another standard that says, well, but generative AI maybe should be held to a different standard. One of the things that we did was we decided all AI is AI. Don't waste time deciding whether something was generative or traditional AI. We anticipated that we were going to start seeing multi-layer stacks, and we absolutely are, where we've got machine learning, but we might have a generative AI user interface. Now we have one policy that governs all of it, and that is our stance. We're going to hold to that going forward. And Joint Commission and CHI also don't draw a hard line between generative and predictive AI. The real way that AI should be governed is by risk and the use context, not necessarily by the model architecture. That is important to document, but it is not the sort of thing that's really going to govern. It shouldn't choose your governance path for you. I had a lot of discussions with folks in cybersecurity as we were working on this policy. A lot of organizations saw their cybersecurity teams first to the AI governance conversation because AI looks a lot like a data and infrastructure risk and it poses data and infrastructure risks. That instinct was really right, and our security partners have been indispensable as we have been writing and firming up our thinking around this policy. But AI governance isn't just security. It's not security. Security is definitely part of it, but there's more to the AI governance story than security alone. It is cybersecurity's job to secure AI. It's our job in AI governance to govern how AI is used. And so we had a lot of discussions with security folks because what we want and where we would still like to land is a list of approved tools or a list of not approved tools. But that decision is a business level decision. It's a procurement decision, and it doesn't really belong in a policy. The policy should set the standard that will allow us to approve or disapprove the use of tools. So if your AI governance and your health system is living entirely inside cybersecurity, you might be underscoped. Think about the use of these tools. Think about the risk that they pose in different environments. And if your AI governance lives entirely outside cybersecurity, then you might be undersecured. Got to have both groups at the table, but make sure that everybody is really clear on what their roles are. Going back to our policy, one of the things that we did that really helped us clean up what was in our policy was we did an assessment of what's already covered elsewhere. So folks inside Cleveland Clinic will know that my most referenced policy is the Acceptable Use of Information Assets policy. that governs what people can and cannot do with enterprise systems and data. We obviously did not need to re-legislate that inside the AI policy and set ourselves up for conflicts in the future. We wanted to make sure that we were leaning on our existing policies where we needed to and only really carving out for AI policy what is specific to artificial intelligence. So I am talking a lot. We are going really long. I'm going to go ahead and split this into two parts because everything I've described so far is the what's in our AI policy, what's not in our AI policy. And in another episode, I want to talk about our road to getting this policy approved, because at an organization like Cleveland Clinic, the approval process it actually has taken us longer than the drafting. And that's good, that's there for a reason. But I wanted to highlight a couple of challenges that we had, and hopefully you can avoid these delays when you roll out your own AI policy in your own organization. I will see you next week.